I just also want to acknowledge the territory that we're in as well, and to say it's an honor and a privilege to be here to speak. So I want to thank CCSA for allowing me to be here. So, miigwech. And so just a little overview. I'm going to talk a little bit about one of the models that we have called Honoring Our Strength as a systems model. And then I'm going to talk about the First Nations community-based treatment approach from a land-based program. And this is basically some information that was that took place in Ontario. And so I'm going to share some of that around a treatment model. So Honoring Our Strengths is a systems model, like I said, that was basically developed in between 2007 and 2011. It came from the community people. They were asking for some kind of assessment to happen across the region, and so every region within Canada from east to west had an opportunity to give their input as to how they saw treatment happening and what kinds of changes and things they wanted to have happen within it. And so as a result of that assessment that happened, this model was developed. And you can see at the very center of it, it says culture, and the three pieces around the next piece of it is individual, family, and community, because those three components are part of who we are as Indigenous people. We don't just talk about ourselves individually, we talk about our family, and we talk about our community. And the next component is the blue elements, and those basically are the elements of care, and so this shows a continuum of care approach that we want to talk about as well. And so it's important from this approach to focus on matching people affected by substance use issues to the kinds of services and support they need at any point in their care journey, and also the coordination amongst partners and sectors to provide effective client-centered services and supports is basically what I want to be the takeaway from this slide. So this next slide looks at reconciliation, is about shifting to a strength-based paradigm. And we as Indigenous people already know the destructive impacts of colonization on the determinants of health for us as people. In fact, if we look at Canada overall, we know that we're the second highest in the levels of PDA use globally, right behind the United States. And non-medical PDA use has been declining in risk populations such as First Nations and remote Ontario First Nations. There is more than 50% of the adult population that report prescription drug abuse users and in need of treatment. And the number of deaths due to opioid overdose are 2 to 5 times higher for First Nations communities. And so I just wanted to share that information with you and say that we want to move to a more of a strength-based role with culture being at the center of it, and understanding that healing from substance abuse culture should be the driver behind it. And we want to make some connections between substance abuse, mental health, and trauma. And you can see from this slide that actually comes from the trauma-informed presentation. Had it yesterday as well, and looking at those connections that we have, and including First Nations components in there, the lack of culture and language and identity, the poverty and the attachment and nurturing pieces as well for Indigenous people. So why would we want to talk about Suboxone versus methadone? And because we know that safety remains an ongoing public concern, and research shows that Suboxone is much safer than methadone. And you can see that it's also a directive that was given in Ontario for any of the programs that were going to be happening within the treatment for Indigenous people in Ontario, was to use low dose and short-term treatment. And so that was the premise behind why they the use of Suboxone over methadone. And the other thing that we want to be mindful of is that we know that methadone has been linked to 1 in 4 opioid deaths in British Columbia between 2004 and 2013, as reported by the Centre of Excellence. So the use of Suboxone within First Nations community is something that makes it more accessible for people to have treatment as well, because a lot of First Nations communities in Ontario don't have pharmacies in the north, and so the accessibility of even being able to use methadone is not obtainable for people. So having access to Suboxone makes it easier to ensure that programming can happen within First Nations communities. And so I want to show you a few slides next around some of the Ontario programs that were happening in Northern Ontario around land-based programming, and what are some of the statistics and information from this. And you can see, you're going to hear some really amazing and great things that have happened within those programs. And these programs actually started 5 years ago, and they were driven by community members who saw a need for the high number of clients within their communities and family members too, that were using substances, and they wanted to do something about it. And so they involved the community care nurse and the physician within the community. They had some use of the FNIB health nurses, were supported, but they weren't allowed to participate in the program, and I can't tell you why, because I wasn't part of the program, so I can't give you the explanation as to why. I just know that they weren't allowed to be a part of it. Community members counted and dispensed the use of the Suboxone within the community, so they could directly observe the therapy that was happening within the community with their clients. And the nurses were more involved in the prenatal part of getting clients into the Suboxone, which is a form of Suboxone that's used to help prevent, I can never say it correctly, the neonatal abstinence that happens to babies when they're born from mothers that are using opiates, and so they became more involved in that part of the program. The program was actually a 21-day outpatient program that started, and basically what they did is they had a 7-day induction period, and they had groups of 3 different inductions at the beginning. So they would take small groups of clients into their program, and they would start to use Suboxone with them, and once they got one group going, they would start another one and another one until they had around 20 clients, and they would take them out on the land and do a land-based program after they spent about 7 days detoxing. And they would spend about 21 days out on the land. And after they came back from being out on the land, they also provided a 2-week aftercare program for them. And while they were out on the land, these were some of the things that basically happened, that they had addictions counseling. They had a land-based programming on their traditional values. They had addiction medicine support, so they were able to use different kinds of medications and things as well. It was a very strength-based program that they had. They did a lot of work around intergenerational historical trauma and PTSD support and recovery for people, because they knew that those were big issues for them. And the big takeaway from this that I think is really important is that this was community owned and it was community driven. And so there was lots of leadership that happened within their community on wanting to make changes within their community. So they owned the program. They did a lot around helping the people. And so being community based and driven, it was also tailored to the individual needs within the communities of what they needed and how they were going to meet those needs within the communities. And these are some of the measures of success that happened with them. And you can see here that the drug-related medical evacuations, because they're First Nations communities, if the nursing station couldn't meet their needs, they had to be evacuated out into a southern hospital. The number of assaults, the suicide attempts, overdoses, and sexual assaults that were believed to be directly related fell by 30%. School attendance increased by 33.3%. Child protection cases, in other words, children being removed from the home because of substance abuse, fell by 58.3%. Needle exchange dispensing decreased by more than half. Seasonal influenza immunizations had dramatically gone up to 350%, so that says just about everyone in the community were getting immunized. Attendance at community events increased, which says that there was a better group within the community, so they were working together and coordinating and helping each other more. The sales at the local general store went up by 20%. That meant that more children were getting food, that they were getting clothing from the community store that gave them access to those kinds of things. Children and elderly patients were being brought in for medical care earlier in the stages of illness, so they weren't coming in looking for help regarding things related to substance abuse, but they were looking for more primary kinds of things that were happening for those individuals as opposed to things that were drug related. I'm going to show you some statistics around a couple of First Nations communities specifically. This is North Caribou Lake program that they had, and they were supported by Chief and Council, so they went to Chief and Council and had a resolution passed so they could have their program happen within the community. And it was developed by a prescription drug working group within the community that happened between May and June of 2012. There were 7 deaths related to drugs within the community, which basically prompted this whole project of happening within this First Nations community. And you can see they inducted the first group in July of 2012, and then they had a group treatment program that happened within the community and the use of Suboxone. And it was mostly a day program, treatment program that they used. So clients would come to the program during the day, usually between 8:30 and 4:30, and they would be allowed to go home at night. And then they spent 1 month at New Horizons Treatment Center after they finished their induction within the treatment program here. And the first week was the use of Suboxone to reduce any of the effects that the clients may be experiencing around the withdrawal and helping them to manage that component of it. And then they would spend 1 to 4 weeks looking at their addiction and trauma recovery and counseling, and they would be involved in traditional activities. And North Caribou Lake PDA program, basically they had 4 different inductions in 2012. 2013 they had 4 more groups. 2014 they did follow-up and individual intakes. And then in 2015 they did follow-up and aftercare programming with those individuals that they had. So they actually worked with a total of 180 community members, and they had a retention rate of 98%, and they had daily observed dosing. So basically when clients came to them each day for their Suboxone doses, they had an opportunity to work with them with their medications or any things that they needed to do around work or travel or shopping. So they spent that time with them. And the big thing also with all of these programs is all of the clients had to participate in some kind of counseling. So it wasn't just come and get some kind of substance abuse program, but they also had to have counseling involved as well. And so from this, North Caribou, basically what they found out that there was more community engagement and more long-term recovery from their program that they had. And from Fort Hope, I'm not going to enunciate the name of the community, but they had lots of successes in their Suboxone program, and what they basically saw was a real decrease in crime, an increase in employment, a decrease in Hep C, decrease in miscarriages, and a decrease in the number of children that were in child welfare as well. These are some of the partnerships that they developed through that whole process, which I think is important, because when we talk about doing any kind of programming within First Nations communities, and even not only within First Nations communities but outside, it's important for us to have different partnerships. And you can see here that they engaged the community leaders within the communities, health directors, program coordinators, and helping with the program. They had the support of the physicians in prescribing the Suboxone or the naloxone, whatever they needed. And they also brought on board the pharmacists to help with those as well. And the nurse or the community health workers were involved as well. And the mental health and NADAP workers providing the support, counseling, and referrals for clients. Because one of the things that they found is after they finished with the Suboxone program, and they even took people out on the land to do the land-based program, that lots of people needed lots of other help and lots of services. In fact, most of them said that they really didn't have enough services, so they did the best they could with the community workers in meeting the needs within the communities, because a lot of other secondary issues came up: housing, education, life skills, those kinds of things also became an issue for them as well. And so there were other partnerships as well that happened as part of this as well, and those natural helpers that they found within the community, mentors that they found of people that had been in the program before that they brought in and used as mentors to help within their program, the use of elders and traditional healers and people to help with the traditional part of the healing as well, and also for counseling and for the aftercare, and the cultural keepers, the traditionalists, and the land and the land-based program that they provided. And like I said, most of them went out on the land, and it was important for them to go out on the land because that's where they said a lot of the healing happened for them, is when they actually went out on the land and reconnected. And it's really difficult for people to understand if you live in a Northern First Nations community as to why you would have to go out on the land. And the reason is because most of us have been affected by colonization, and we don't know how to live out on the land. We don't know how to survive out on the land. We don't have all of those skills and those things. And so being able to go out and being in those safe places and learning and being exposed to some of those things is helping our people. And bringing the language and the culture into that and teaching the people about those is also part of that being on the land with our people as well. So it's important that they have those pieces in there as well. So we have lost a lot of those traditions, and it's important that we regain them. And so this was part of that, and helping them to find their identity, to learn about hope, belonging, and meaning and purpose for themselves, and to recognize their role within the community. Where was their place, and how could they fit or belong within the community? Because through colonization, those family and those cultural values and things have been broken down and fallen apart as well. So it's a real recovery, not only for the individual, but for the family and the community as well. And looking at different kinds of partnerships around employment. And for some of the communities, employment is almost non-existent. So what were some of the kinds of things that they could do? So looking at volunteering and finding a purpose for people within the community, so they had a role, and maybe helping at the school, or maybe serving at different functions or things like that as well. Education and training was also a big partnership that they needed, because once you've gone through this whole process, then you need to learn new life skills, and you need to be able to function and be able to manage your own life and those kinds of things. And so they needed to create partnerships with those as well, and making sure that those kinds of things happen for First Nations communities. So when we look at moving to recovery, one of the examples we have here is from the Northern Ontario NAN Chiefs, that they passed a resolution in called Restoring Our Nation Action Plan for Community Recovery from Opioid Addiction. And basically, they said they had 4 strategic directions that they wanted to look at. And they want to use Suboxone as their method of treatment, because they, like I said, lots of them struggle with not having pharmacies. Security and policing to reduce the supply of illicit drugs is another key direction that they want to look at. Prevention of next generation being addicted and reducing demand. And the 4th one is deal with root causes such as the suicide crisis, the residential school impacts, the trauma, the grief, and the loss that come from those different impacts of those causes of things that have happened to their people. And when they started to implement this program, the outcome for them was that they wanted to ensure that they had 40 community programs, and that they wanted to have over 2,000 clients that were on Suboxone as their goal. So when we look at First Nations community-based prescription drug use programs, one of the things we want to ensure is that First Nations governance of community-based program is from the people, because it's the people that know the answers to their problems. And so ensuring that it is community-based, and to ensure that addiction physicians should be supported to assist in the Suboxone treatment in First Nations communities. Funding that is stable and operational for programs including treatment, recovery, relapse, counseling, culture, land-based programming. Training for all the community programs around, especially to support Suboxone and the cultural-based programs, and training and support for recovery from the intergenerational historical trauma and PTSD. And First Nations community-based drug abuse programs should be offered to First Nations people, whether they live on reserve or off reserve, because many of our First Nations people do live in urban areas, and so being able to go back to their home community to participate in recovery programs, I think, is important. And ensuring that those people that are supported through that process, because a lot of our First Nations people right now are using the methadone program and supporting them in that transition to going on to Suboxone. And we do know that there are some people who will only be on methadone for the rest of their journey through that healing that they're going to have happen for them. But for many of the people, they say that they want to get off of methadone and they want to move to Suboxone. So ensuring that that happens for them. And that we have more involvement with programming for young people, especially those 25 years and younger, that we are able to offer a full range of treatment options for them, including an abstinence-based treatment or opioid substitution therapy. I'm getting tongue-tied here, sorry. And all those consenting to the substitution therapy, that they receive counseling, and that's part of the, that those two go hand in hand, ensuring that it is there for them, and that when they come for some kind of treatment program, that they have those as well. And you also want to look at the neonatal abstinence syndrome, ensuring that we look at some of the needs of our young mothers and mothers that are having babies. And you can see that the prevalence from 2003, there were 171 babies that were born, and by 2010 we have 657 babies. So we can see that there's a significant increase in the neonatal syndrome that's happening within First Nations communities. And this is statistics taken from Ontario, and that the rates for NAIDS are 5 times higher amongst infants born to mothers who deliver their first child prior to the age of 19. So looking at those young moms that are having babies, that there's a high likelihood that there will be a neonatal abstinence syndrome happening. And at least 20% of First Nation births are to teen mothers. So keeping that in mind, and the untreated opiate dependent mother and her baby is a critical trauma to our communities, because right now we see lots of babies that are being apprehended at birth, and so that's a significant issue within First Nations communities. We have more children now that are in foster care than we had throughout the whole residential school, and so that's becoming an alarming statistic for us as First Nations people. So looking at and finding ways of treating and taking care of those kinds of aspects is important as well. And pregnant women addicted to opiates tend to deliver earlier and faster, so there is also the need for postnatal care closer to home for our moms. I was happy to see not too long ago where we even have someone that's going out of the community when lots of the moms that they have someone to assist them, but we also need to start looking at what kinds of services we can provide in the postnatal care, and ensuring that mom has a good start with that new baby, that there's that attachment and bonding that's happening with them, that they're connected to the culture and all of the teachings and stuff that go around bringing that baby up in a healthy, happy environment. And we know that this is a really significant issue in rural, isolated and remote communities. So the use of butyropropylene should be designated as a first line of treatment for First Nations women who are pregnant and addicted to opioids, is basically the message that we are sending. And that women can return home more easily if they're able to use Suboxone, because we know that it can be administered within the community. The treatment has the same kind of outcomes as other monitored opiates for pregnant patients, and studies show less intense and shorter duration of the neonatal abstinence syndrome when Suboxone is used over methadone for mothers that are pregnant, and babies have better birth weights with Suboxone over methadone. And when support is provided to moms and babies in treatments for opioids, there are better outcomes than when the babies are taken and into child welfare and are separated from their moms. So what are we doing to help to support First Nations communities as an organization? One of the things that Thunderbird has been involved with is the development of the opioid survey, and it's designed to help identify how to better understand and address opioid use within First Nations community, and to fill those gaps of knowledge, because we as First Nations community don't have a lot of stats or data around how many people are using within our community. So this is a good tool for us to begin to use to collect that data and have the pertinent information. So not only what are the needs within our communities today, but 2 years or 5 years, so we can do some long-term planning as well. And to also look at what are some of those targets that we need to look at in the now and in the future, and being able to effectively deliver programs within our communities. And ultimately, this data will also to help inform and evaluate policy, prevention, and treatment interventions that can happen within our communities, because we'll have the information to do it. And Thunderbird has also been involved in a community-based town hall, and the focus is on harm reduction through community-based opioid treatment. And this is in partnership with addiction specialists, with physicians and nurse practitioners and elders, cultural practitioners, to ensure that the conversation can result in an action, so that we have engagement with First Nation government supported by a BCR community health policy, engagement of community partners such as school, pharmacy, police, and other agencies. And so I basically want to leave you with this little closing thought. And Creator gave us tomorrow to make a difference. If tomorrow can't be any different than today, then what do we need tomorrow for? So I want you to think about tomorrow and who you wish to continue the dialogue with to effectively move towards wellness for First Nations people. How will you collaborate with Indigenous leaders and elders for community-based addictions and mental health? So thank you.